Assalamualaikum warahmatullahi wabarakatuh to Dr. Khairie, and today our group will present about mask policies information by KKM Facebook page during COVID-19 pandemic.
I will explain about the overview and the issues. So, the organization to be audited is the Ministry of Health, also known as KKM. KKM is the Malaysian government ministry responsible for the health system through the KKM and a variety of other government agencies. KKM aim to help people achieve and sustain a health level that will enable people to lead a productive economic and social life. As we all know, the world is currently dealing with the COVID-19 pandemic crisis. This pandemic has affected more than 200 countries and provinces worldwide since the earliest coronavirus 2019 in Wuhan, China, with the 2 million cases and more than 120,000 deaths by April 2020. KKM plays a major role in conveying and updating the latest update on COVID-19. They often help to remind and advise individuals to comply with the standard operating process or known as SOP. In this paper, we would like to see whether people comply with the SOP issued by the KKM, so we decided to emphasize the transmission of message by KKM through social media such as Facebook. As we can see, KKM's primary goal is to raise awareness about COVID-19 and prevent the virus from spreading to others. The transmission of message is therefore very important because people every day look up to KKM's daily update. Therefore, KKM chose several types of communication media such as interactive media where they use social media to spread awareness and update everything about coronavirus. Next, as for the issues, we can see in the survey that most respondents claim that social media has helped to spread the correct COVID-19 information. Just a handful responded negatively. In the early stages, many people do not pay attention to the rules issued by KKM. Therefore, there are still many people who do not comply with the SOP. They left the house without wearing face masks and did not follow other SOP as well. In addition, the use of Facebook by KKM is updated daily to deliver the message. However, as for some unfortunate people, they know that there is a new standard of living where wearing a mask, washing hands as much as we can, keeping social distance is a must during this critical time, but they seldom apply the actions. However, for certain people, especially in rural and remote areas, it is difficult for them to access information. They are facing difficulties such as internet issues due to the troubles in getting coverage or sickness. Some of them are not afford to have any gadget nor internet for themselves. The lack of access to the internet has had a significant effect on the lives of people during the pandemic crisis. As time passes by, most people are already aware about the usage of face masks. We can see that a lot of people are wearing their masks now. In raising awareness of the pandemic situation, social media has been helpful. They also claim that it is also very helpful to have all the updates and reminders from
Okay,
KKM's
so I will
Facebook.
talk about the methodology of this audit research. This audit research used a qualitative method that presents an interview session. This method being used to reach the audiences as the Facebook user. The data collection process from this method will shorten the time as it is the easiest way to collect information. We choose interview as our instrument as it will bring details and depth understanding about the full implication about the Ministry of Health Facebook page to make public. Follow the must wear procedure correctly. This audit were being prepared to measure the method how the government used the media social application to convey message and information about the mask policies and procedure to ensure that public will follow and obligate the instructions. An interview is generally a qualitative research technique which involves asking open-ended questions to converse with the respondent and collect illicit data about a subject. Questions for semi-structured interview were designed before the interview took place. Basically, the question divided into 3 sections. The first section is referred to respondent name, age and their location. The second section is concerning whether they have Facebook account or not. And the third section focuses on their concerns about the government instruction during COVID-19 phase. The researcher has designed open-ended question for interview. The interviews were done through face-to-face by relatives or known people. They provided their opinion by filling up comment box. Interviews were originally done in English. All the answers that have been gathered will be analysed and recorded. The listing will be prepared to ease the analyse process from the interview. The analysing process will be recorded according its category. Firstly, it's about how the information gathered is being perceived by a Facebook user. Then we tend to know how the information or news will be accepted by users. Lastly, we can analyse the action taken by public about the mask policies, whether they follow or not even following them.
The next one is the critical analysis. In this communication audit, we use the social cognitive theory. This theory describes how public learn behavior by witnessing others. It focusing on the collective action of an individual behaviors. We use this theory as it offers a philosophical basis for how media usage affect the thoughts, effects, and behaviors of human beings. Based on this social cognitive theory, it can be applied on the KKM Facebook page to deliver message which affect the public behavior wearing masks. During the pandemic, based on the interview conducted, all the participants have spent their time on Facebook getting news about COVID-19. Lee and Yu 2020 mentioned in their article that the degree to which public use social media to retrieve health information for disease management may affect a person's health behavioral outcomes. Based on the theory, this shows that social media like Facebook will be the first medium on where people to reach information about COVID-19. This will affect their preventive behaviors on following SOPs like washing hands, wearing masks, and social distancing. All the participants have visited the KKM Facebook page every day. They are also aware of the message and follow the SOP suggested by the KKM Facebook page. Young and Wu 2019 stated in their article that social media like Facebook and Weibo can produce positive changes on the public. This demonstrates that KKM Facebook message help the public to change their behavior wearing masks when they need to go to public places as suggested by the social cognitive theory, where it will affect the use of media will affect the behavior outcomes. Next, based on the interview conducted, the participants are aware with the compound 1000 ringgit if they are not follow the SOP suggested by the KKM Facebook page, such as wearing masks. Lee and Yu 2020 mentioned that social media can magnify the public's fear and urge the public to take preventive measure. For example, the KKM Facebook page has posted about the compound and this urged the public to change their behavior to wearing masks when they go out. The participants also consider that the message by the KKM Facebook page helped them in following the SOP such as wash hand, social distancing, and wearing masks. This shows that the official social media by the public health agency such as Ministry of Health help the public to understand the message which allows them to change their behavior and follow the preventive measure, specifically wearing masks. Based on the social cognitive theory, it shows that KKM Facebook page affects the behaviors of public where they need to wear masks when they go out. Last but not least, critical analysis summary shows that Ministry of Health using the Facebook page as the transmission of message regarding the SOP such as wearing masks, wash hand, and social distancing during the pandemic. This is aligned with the social cognitive theory which the media usage contributes to behavior change among the public. Also, based on the interview, the participants engage with the KKM Facebook page, message, and post. This shows that the communication by the KKM Facebook page allow the public to understand and change their behavior, like wearing a mask when they are not used to, like before the pandemic.
So that will be explained about the recommendation for KKM in order to have a good communication and also enhance their communication with the public. So the first one is social media. We know that social media is being used by so many people right now, and also during this pandemic, the increased usage of social media really boost up, and also with social media, KKM can update anytime, anywhere on any platform that they have to be able to send a message to the people that this is our current case, this is what we're gonna do, and such thing like that. And also with using social media, KKM able to reach so many layers of people from the senior citizen, the young adult, the adult, and also the teenagers who are also on social media. So this is very comes handy when trying to communicate with those we cannot reach out physically. So saya kind of one infographic. So I I read a lot of social media. I read a lot of social media. I'm always on social media. I often see infographic about COVID-19 that really is not eye catching. So people will tend to just will just tend to ignore it because it's not eye catching. It's not well designed. So people will just brush it off. So having eye-catching graphics and well-designed infographic able to attract publics to read, and also because of the pictures of or the what we call design graphic, it also will have it's very persuade us to read about what the situation is, what the what's COVID-19 really is, and educate people about how the dangerous the virus is and what precaution we need to take, and also it helps us to be reminded that, oh, this is a really pandemic. This is not already the temporary like flu or fever. It's the virus can be deadly. So infographic can comes handy for KKM. They can post it online, they can post it offline, or they can just have it anywhere really. So the third one and the last one would be television. So KM could take advantage by having this by posting advertisement or mini session, because Malaysians like to watch television during their leisure time. It's very nice to have a lot of viewers who watch TV. So KKM could make or collaboration with anyone who's well touched, well well designed with maybe creating a cartoon or like a public service announcement about the COVID-19. It will remind people that we still in pandemic. This is not over yet. Even though there's vaccine, it's not the proper. It's not the ultimate cure. But we need still to wear our masks, do physical distancing, and also wash our hands as often as we can. So as we know that not only the senior citizen but also everyone loves to watch TV. So if the advertisement or the cartoon is of the TV, KKM could upload to their YouTube, and also if it is really good and people able to decode what the message is, they will mostly to share it to the people, and also share it anywhere platform that they have, and it will it will enrich them about the information about the COVID-19, and also help them to understand better about the situation that we are in. Thank you.
So here the conclusion, the mask policies during the COVID-19 pandemic that being mandated by the government may have yet unknown social and behavioral consequences related to the effectiveness of the medium transmission that conveyed by MOH. So most of the Facebook users know and aware about the mandatory if they are not wearing masks when they go out because of the COVID-19 pandemic. In fact, people know about the consequences of health if they are not wearing masks outside. Mandatory policies appears to be an effective, fair and socially responsible solution to transmission these airborne viruses. The usage of Facebook for conveying the information was a necessity that need to be continued by government to always update the latest information about COVID-19. This application is also known as one of the largest medium of information transmission that people access to gain knowledge and information. So, beyond this finding, our paper presents a useful conceptual framework to investigate the relative roles of mass policies and information on determining the spread of COVID-19 by MOH Facebook page through their impact on people's behavior. Our instrument also allows us to explicitly define counterfactual scenarios to properly evaluate the effects of mask policies among public on the spread of COVID-19. This will raise awareness about the correct procedures on how to wear masks correctly or to follow all the standard operation procedure. That's all from us. Thank you.